Executive Director of DC Scores. We have a coach, Aaron Cannon, and we have a board member who is no stranger to the Department of Health, Dr. Pierre Vigilance. And if Chris Bradshaw is here, Dreaming Out Loud. Okay, so he will be here. Is Dusky Holman here?
Yes.
Come right up. Vice President and General Counsel of Volunteers of America Chesapeake. Welcome. Oh, I'm sorry. I skipped Dr. Tom. I'll call you next. I'm sorry. Welcome, and you may proceed with your testimony. Heard a lot yesterday at yesterday's hearing in education, too.
Yes, ma'am, and we'll try not to be repetitive. Thank you, Madam Chair, for allowing us to testify. My name is Bethany Rubin Henderson, and I'm the Executive Director of DC Scores, which, as you know, is a over 20-year-old nonprofit that provides sports enrichment opportunities to more than 1,500 3rd through 8th graders each year at between 40 and 50 DC public and public charter schools. We've worked with over 8,000 students since our founding in 1994, and this year our diverse participants are 56% African American, 40% Hispanic, 2% Asian, and 2% white or other ethnicities. Approximately 80% of our students, our participants, receive free or reduced lunch. And thank you for letting me testify today about the critical role after-school sports enrichment programs play in ensuring the health of DC's most vulnerable young children. Roughly 1 in 3 children in DC are still overweight or obese, and the percentages in the low-income communities of color that we work in are often higher. Yet many of these children have little access to sports enrichment, and in fact, our parents report that nearly half of the children we serve have no other opportunity to play organized sports except for DC Scores. We provide our sports enrichment programming in a school-based setting, free of charge to our students and their families, so it is accessible to every child, no matter their parents' income. Now, our work not only complements the work of a lot of the other organizations who've testified here today and what happens in the schools and the health and wellness committees, but it also fills this critical gap of having an organized sports opportunity. To give you a sense of the breadth and depth of our impact on the health of DC's kids, by design, half of our players are girls, half are boys. Each week during our 12-week seasons, every single one of our participants engages in 270 extra minutes of structured physical activity, six times what most get during the school day. In FY14, 87% of our female participants and 78% of all of our participants improved their BMI percentile over the course of a single DC Scores season. 65% also improved their aerobic capacity over the course of that season. Now, notably, we are not meeting the need for programs like ours in the district. We have a wait list going on 10 schools deep and growing. And our middle school soccer league is so in demand that charter schools without DC Scores regularly ask us to accommodate their soccer teams in our league. Now, we appreciate a lot of support that we get from the city, and we rely on school facilities, classrooms, and fields critically being accessible until 6 p.m. daily. This past year, we were able to leverage that support from the district to bring in over $1.5 million in additional private funding into the district to help improve kids' health and well-being. The proposed cuts to the DCPS out-of-school time office, after-school funding in general, and the DC Trust in the proposed FY16 budget, coupled with our unexpected loss last fall of nearly $400,000 in anticipated federal pass-through dollars, threaten to make it challenging for DC Scores to continue providing our sports enrichment programming at the same scale in FY16. And so we are here to let you know that we stand ready to work with this committee to help ensure healthy habits are able to be perpetuated through our children through programs like ours.
Thank you for your testimony. I'll hold my questions until the entire panel. Good morning, Coach.
Good morning. Good morning. My name is Aaron Cannon. I was born and raised in the Washington, D.C. area. I currently live in Ward 5. After earning a basketball scholarship from Friendship Collegiate Academy, which is in Ward 7, I attended Central Christian College. There I received conference honors and All-American nominations. I graduated college in 2014 with a bachelor's degree in sports management. I currently serve as an AmeriCorps National and State member in the Coach Across America program, for which I won the 2014 Mayor's Community Service Award for National Service from Serve DC. I am spending my service year as a soccer program coordinator and soccer coach with DC Scores. I have coached at 3 different schools during the DC Scores calendar season: Wheatley Elementary School, which is in Ward 5, Thompson Elementary School in Ward 2, and Tubman Elementary School in Ward 1. With me growing up in the inner city, facing daily challenges from our urban communities, and dealing with family issues, life has felt unbearable at times. Playing sports has always been my outlet, so I feel I can relate to the children. I wanted to share with you what I'm seeing on the fields and in our schools about what access to organized sports is doing for our kids that I coach. Last fall, I coached the Wheatley Wells Elementary School team. In the beginning, things were going great. I had a full team of both boys and girls excited to be on a soccer field. But as the season went on, I realized that our community affects a child and more than people will know. And that being a big part of DC Scores team didn't just help my kids get more physically fit, it was really important to their mental health too. I had 4th graders on my team participating in gang-related activities. Some kids never had a meal until they got to school. Some children would literally wear the same clothes every day because they didn't have any other clothes. And I had several kids that had untimely deaths in their family. This was all in a 12-week season. With having to deal with all these outside distractions affecting my players while also trying to teach the kids fitness habits and soccer rules and techniques, DC Scores became more than just soccer and writing to me and with them. I started out as just a soccer coach, but I felt I had more of a bigger responsibility to uphold to my team. A lot of times I became these children's confidant, and their trust in me went far beyond just me being their coach. I became their friend. I see in the kids I coach how DC Scores not only helps kids and stay healthy, but provides so much more. It gives children a positive, safe outlet where children can actually be children that time and learn to channel their frustrations and their situations into positive thoughts and outcomes that include healthy bodies. Having played college athletics myself and experienced how powerful athletics were to helping me get to where I am today, I know that having these outlets can lead to a success of a child. I just want to thank you for letting me speak and have a great day.
Thank you for your testimony. Good morning, Dr. Vigilance.
Good morning. It's good to see you. Thank you very much for the opportunity to testify before you. The seat's a bit cooler, actually, I think, than I remember it, but anyway. My name is Pierre Vigilance. I'm the Associate Dean for Public Health Practice and Associate Professor of Global Health at the Milken Institute School of Public Health at George Washington University, and I served the district from 2008 to 2011 as the Director of the Department of Health. I also serve on the board of DC Scores, an award-winning youth development organization that uses the modalities of soccer, poetry, and service learning delivered through team-based, school-based after-school programs and summer camps to instill self-expression, physical fitness, and a sense of community in DC's most vulnerable 3rd to 8th graders. As you know, it takes more than the Department of Health to influence health outcomes, and it gets my involvement with DC Scores comes from really the stories that so many of our children tell us about the fact that the programs that we strive to maintain for them make a difference in their lives. That, combined with the fact that we teach them how to value their health and education, elements that are critically important, particularly for this age group, as they strive to succeed in life as productive members of society. DC Scores helps instill essential life skills and healthy habits related to physical activity and nutrition. In addition to attending schools with low academic achievement and low graduation rates, the children we serve have few sports enrichment options, which is why I'm so deeply troubled by the evaporation of public funding for after-school programs such as DC Scores. Programming like this is essential to a child's development. Not only does it contribute to their academic performance, but it enhances their interactions with their peers, instills a sense of self-appreciation and emotional well-being. Physically active, creative kids are just more balanced, and most importantly, they're happy and healthy. Obesity is safely one of the most complex public health problems of our time, and recent commentary about the epidemic slowing should be taken in context. DC still has among the highest percentages of overweight children in the nation and the biggest disparities between races in terms of obesity. For example, 40% of DC Scores participants are Hispanic, and Mexican-American children are 1.4 times more likely to be overweight than their non-Hispanic white peers. It should also be noted that the burden of overweight, obese children in Hispanic children has risen from 12 to 24% over the last 2 decades. This fall, DC Scores experienced an unexpected setback in our ability to meet the needs of the youth and families we've committed to give a better start. Nearly $400,000 of federal pass-through dollars we anticipated receiving for this year vanished without warning, 6 weeks into our fiscal year and in the midst of the launch of our 4 programs. I'll just finish this sentence. The local funding agency informed us that the funds had been redirected away from youth development to the chronically unemployed. And as the executive director has mentioned, we look forward to being able to work with you and other members of council to be able to see if we can address this. Thank you again for the opportunity to testify before you.
Thank you, Dr. Vigilance. Just to set the record straight, this gentleman sitting next to me said that he was a student of yours and you were kind of tough on him.
Well, the seat does need to be warm for students, I think. It's the only way that they get better.
Thank you.
And look where he's sitting now, so it must have done something right.
Right, you did something right. JD Master of Public Health, so you did something right. I just wanted to state too, Dr. Vigilance is such a, it speaks volumes that he's testifying on your behalf. I will never forget, Dr. Vigilance, when we had that press conference and a car accident. I just will never forget that as long as I live. It was a terrible car accident. The car's flipping over and everything. And he went straight out of Director of Department of Health to Dr. Vigilance and ran to the scene of burning car. It was crazy. It was really crazy. But this man has commitment that I will always remember. So if he's testifying on your behalf, DC Scores must be awesome. That's all I have to say. But on that note, good morning. Thank you. For DC Scores, so is the only funding not being replenished the $400,000, which is a sizable amount? That's federal dollars.
So that's direct federal dollars that we were granted through a pass-through grant, actually through the Department of Human Services.
Okay.
Okay, but also, in addition, call this committee's attention to the health implications of the changes in the education budget.
So what happened? They just, that funding is no longer available.
We were told that funding had been redirected away from youth work to serve the chronically unemployed adults, also a very important issue. But we were not given any advance notice.
So what about funding from the trust or DCPS or federal funding? Do you have other sources of funding?
We do. So we're mostly privately funded, although this was about 15% of our budget, this $400,000. But we do get some money from DCPS, a little bit from the trust as well. And our concern is that given what is going on in that budget this year, right, so changes to the after-school programming and other things, that is exacerbating our ability to serve the number of children that we already do.
Okay. So have you received funding from DOH?
We have not received funding from DOH.
Okay. And would this qualify? Because I know that there are some grants available through DOH. Have you ever so you've never competitively applied for a grant with DOH before?
I don't know the answer to that question over our 20-year history, because as you know that I'm new, I know that this year we do not have funding.
But the amount you're looking for is $400,000.
Yes, ma'am.
And that's to replace the human services.
Yes, ma'am.
Money. And to the coach, that's Coach Cannon.
Yeah.
Congratulations to you. And so is this what your career is now, or do you volunteer with DC Scores? Are you paid through DC Scores? How does that work?
I'm currently serving in the AmeriCorps year, and so
Okay.
I'm working with the Coach Across America program, and I was placed at DC Scores with the organization because it kind of, in hindsight, is what I want to do overall within my professional career. However, everything you said, I'm kind of all of it. Volunteer, full-time employee, assistant, anything you want to say, I'm all of it. But mentor,
advisor. So you play basketball.
Yes, ma'am.
But how did you get into soccer? And is soccer something that everyone can participate in more?
Soccer is actually a very, very physical, team-oriented, and a great sport. And soccer and basketball share a lot of similarities, believe it or not. So some of the tactics and strategies that I've used and learned over my years of playing basketball, I apply to practices and games, and they work just as fine, and the kids don't even know. A lot of times I use like basketball drills, and they don't even know, and soccer, and they learn the same concepts. And a lot of my coaches and techniques is more of like, I try to teach life lessons within my coaching practices and techniques to my kids. So it's more than just a game. It's how to prepare yourself for certain things.
And what else does it involve aside from the physical activity, which is very important? And competitively, are there teams formed?
Yeah.
They play competitively with other?
Yes. So we have 47 schools that we go throughout, and those 47 schools are broken up through middle school and elementary school. And so we have an elementary school league, and we have a middle school league. And some of our middle school leagues, we have outside schools that participate, such as Friendship Paul.
That's great. So are the soccer teams, do they belong to are these DC Scores teams, or are these the school soccer teams?
So they're both. So DC Scores runs the league and runs the teams and integrates the teams with our poetry and service learning curriculum as well. So the students play together, they get physically fit together, they get emotionally healthy together, they learn how to affect their community together, they learn self-expression, develop those habits Coach Cannon was talking about.
Yes.
But every team has DC Scores in the front and their school on the back.
And Dr. Vigilance, are you a soccer player? How did you get involved with DC Scores?
Well, I love soccer. I call it football, as you know.
Football, that's right.
I love spoken word, and I think that we make health and health outcomes sort of solely the purview of health agencies, and I think that that's a mistake. I think that this health outcomes are an imperative for education agencies, economic development agencies. They relate very much and very closely to the outcomes that we want for those other places as well. So wanting to sort of be involved with a very collaborative and interdisciplinary practice and organization like DC Scores puts me in a position to really be involved in practical public health work.
Great. Do you have a relationship with DC United? I would think all that we've done, they should be giving you $400,000. But what's the relationship with our professional soccer team?
We've had a relationship with DC United, and in the past, DC United members have participated on our board as well, members of their team. And so we do work with them. We would like to work more closely with them in the future as well.
Okay, well, we'll see what we can do. $400,000 is the ask. We'll look into it.
Thank you.
Thank you for your testimony.
Thank you.
Thank you.